So let's talk about your first quarter as a public company. How is that evolving in the midst of this pandemic?
It was good. We're super happy to be done with the SPAC process. We're super excited to be, on our journey as a public company. It was a strong first quarter for us. We are happy to continue to see that consumers, consumer interest is there. It is, so we're enthused. And where I think about my opportunities, it's really on the areas that I, emphasized during the SPAC process, which is really therapeutics, translating all this data into therapies, and then the opportunities for us to help our customers do more and really getting more and more into that world of care and primary care.
We're always so fascinated by your take on sort of public health messaging and obviously, what's happening, the latest that's happening, in these very difficult times. Curious what you think about the CDC and these booster recommendations and the continued confusion around boosters themselves.
I think it's hard. I think people just don't have a strong understanding of how they work, how the vaccines work. And I think it's something even I was reading about, Andy Slavitt was posting on things the other day on Twitter, and how, with Delta variant that you can potentially get like a significant number of, a significant amount of virus in your nose where the antibodies just aren't going to be able to combat it. And so you might need to have, for the immunocompromised, you're going to potentially need to have the additional boosters, and that there's also just the reality that the vaccine is going to prevent the severe infection, but not going to prevent infection in general. So I do think that there's still a lot that the scientists are learning, and a lot that the world is figuring out, and a lot of misinformation. But the most important thing is for people getting vaccinated, and for researchers to be empowered to continue to study it.
So, what do you think of the public health messaging here? What do you think of the messaging that's coming from the CDC? Are they being fast enough? Are they being transparent enough? Yesterday, I had the CEO of Kinsa on the show, who said, I'm going to get a booster when I can. I'm doing the same for my family to protect myself.
Well, I'd say the area that's the most controversial in the world I live in is whether or not children should actually have this 4 months of, or I don't know if it's 4 or the 6 months of follow-up versus what they did for adults. So I do think that there's a lot of parents, and I'm one of those included, that is saying, our kids are going back to school, and I would love to actually have my kids vaccinated. So I do think that, the messaging is in part reflective of the fact that we are in a very dynamic state where we're constantly learning something new. And I do, again, my experience of working with the FDA and with other groups is I do have faith in the public health systems, and I have been encouraged by them updating, and they do tend to be cautious. But I am, for instance, pushing to be able to get my daughter vaccinated sooner rather than later.
All right. Now, 23andMe has been researching the connection between genes and COVID to better understand if you catch it, how will it affect you? You found some fascinating connections with blood type, severity and connections there. You're now researching other things like long COVID. What else are you hoping to find?
Well, long COVID, I think, is just fascinating, and it's going to be an issue. And I think, frankly, it's not unique just with COVID here. You actually have a number of viral infections that have this kind of long tail. So I do, I push the team to say, let's, we have this incredible survey infrastructure where we can easily reach out to our customers. And I think long COVID is going to be a big public health concern. So we should embark on that research now. So we are talking about putting out that surveys. We'll put it out at some point and really see whether or not we can understand long COVID better. We did recently also find these genetic associations with the olfactory genes, and why some people are likely to lose their sense of smell. So that, again, is, it's a piece of the puzzle that we're trying to contribute to.
Meantime, your collaboration with GSK, you've got 40 or so various programs in development. Talk to us more specifically about what you're most excited about, where you're most excited to see some breakthroughs.
Well, I have to say, I love drug discovery is one of the most interesting areas, and it's also such a challenging problem. So in such a short time frame, 23andMe has been able to collaboratively develop over 40 programs with GSK. We've said that GSK has CD96, their first program that is in the clinic now in phase 1, and 23andMe has a program that is solely owned behind it called P006 that we have said would potentially be in the clinic before March of next year, or end of March of next year. So I'm really enthused because I think that genetics really has this opportunity to make drug development more successful and faster. And so for 23andMe to be able to say, we're empowering these customers to come together, and now we're actually going to really help you benefit from the human genome by actually now having treatments and cures that have come from this crowdsourced community is going to be amazing. So I'm really enthused about, our lead program that we have in collaboration with GSK, and I'm really enthused about the program that we have entirely on our own.
You're also doing some really interesting research in women's health and recently published on reproductive aging in women. What are you finding there that we didn't know before?
Oh, to be honest, one of the things that's fascinating about 23andMe is we do research at scale. And so we have this ability, we can ask thousands and thousands of questions to our customers. And so frankly, I lose track of all the research that is coming out. We have so many discoveries that are coming. And what I really like, when we started this company, I set out to say, I want to be able to create research at scale so that we can answer hundreds and thousands of questions almost all at the same time. So to be honest, I have this, I haven't read that paper.
So then talk to us a little bit more about your evolving role in playing a greater role in our health. You've got this 23andMe Plus premium subscription service. Talk to us about how you see that expanding.
Well, what's so interesting, when we started the company, and Francis Collins, who's the director of NIH, he came out years ago and said, genetics has the opportunity to help people prevent, predict, and treat all human disease. And what, frankly, I'm most excited about is this area called polygenic risk scores. And this is where we can help every single person understand what their inherent risk is for all common diseases. And what's exciting there is that if you know you have a risk factor, for instance, something like type 2 diabetes, can you identify early the opportunity to change people? So can you not necessarily just focus on the treatment, but really help people prevent? And so there's areas that we just absolutely miss, like glaucoma is a really interesting area that we've talked a lot about, where if you have glaucoma information, you could 100% get people actually thinking about preventing or diagnosing earlier.